Hello, in this video, I'm going to be talking about the ketogenic diet and breast cancer. Before I go on, don't forget to subscribe to our channel. We're always putting out new content, and I'd love to extend that invitation to you as well. So what is the ketogenic diet? Can it help with breast cancer? And what are some of the concerns about the ketogenic diet? So a ketogenic diet refers to a diet that's low in carbohydrates, and instead of having carbohydrates to burn, your body will actually burn fat and protein and create ketones. Anything that ends in genic means it produces something. So a ketogenic diet produces ketones in your body. Sometimes people who have ketosis, people with diabetes who are quite ill, you can smell the ketones on their breath. Most people on a ketogenic diet, you can't smell that, and you actually don't want to, because that's a form of starvation. So let's just get that out of the way and talk about why this might be helpful. There is some evidence that a ketogenic diet can help people who have diabetes and people with obesity. And you'll often hear people that are saying they lost a lot of weight on a ketogenic diet, and that can be true. In breast cancer, there have been a couple studies that have been done. One has been done in mice only. If you're a mouse, it looks like the ketogenic diet may interfere with the division of cancer cells. It may actually impair their ability to divide. As many of you have written in, cancer likes to have sugar. It takes up the sugar in our body. And so you could imagine getting rid of carbohydrates in the bloodstream could actually decrease the ability of cells to divide. It's really important to know that we have glucose all over our body. If we didn't have glucose, we would actually die. You need glucose in your body for most organs to function, and certainly for your brain to function. So we don't want to get rid of all carbohydrates in our system. We don't like excess carbohydrates, of course. So another study was done in people, and it was also done in animal models, and showed that there may be some benefit. The biggest problem, of course, is that to put people on a ketogenic diet only without treating them for breast cancer with treatments we already know work would be unethical. And if we do this only in people who are declining any standard, well-tested breast cancer treatment, they differ systematically from people who would be treated with standard therapy. So it's not ethical, given the decades and decades of evidence we have supporting proven breast cancer treatments, to treat somebody with a ketogenic diet alone. Doing studies in a lab animal or doing studies with a bunch of cells in a laboratory does not equate to doing the study in people. There's always more to be done, and we're always looking at the data supporting different diets or other things you could do to help increase the likelihood that your cancer doesn't come back, and of course, to decrease the toxicity of other treatments. When people are undergoing breast cancer and they go on a different diet, they can have all kinds of symptoms like fatigue and weakness, and a ketogenic diet can, because we're cutting out fruits and vegetables, can actually lead to some vitamin deficiencies. What I'm leading up to here is that if you are altering your diet, you want to make sure that you're under some form of supervision. When we're undergoing treatment or any serious illness, our body needs more energy, not less. And what you don't want to do is put your body in a state where it's having to work harder to get its basic nutrients and building blocks of healthy muscle and other tissue, especially your brain. We want to make sure you maintain good energy levels. And so to do something drastic to your diet without being under supervision or being watched and monitored by somebody who cares about your health would not be in your best interest. And thus, that's why we don't recommend major dietary changes without you talking with your medical team. Being deficient in energy, building blocks, and in vitamins would not be the right thing to do, especially when you're undergoing treatment for something serious like breast cancer. The bottom line is that a ketogenic diet, or really any other dietary modifications, are not a substitute for what we consider standard treatment at this point. Standard treatments have been tested over many decades to be and have been shown to be effective in improving survival and recurrence rate. And yes, of course they have side effects. Even placebos have side effects. So we acknowledge that, but we don't want you to not get the best treatment for you. As always, drop a comment or a question below. Tell us about your experience. Share your thoughts and your concerns with us. And as always, thank you for watching.